Good morning, respected judges and my dear friends. Thank you for the opportunity. So I will be speaking on randomized control trial on binocular polarized video games versus contact lens versus occlusion therapy. So as we all know that amblyopia is a neurodevelopment ocular disease manifested as monocular and binocular impairments, including vision reduction, contrast sensitivity, and even loss of stereoscopic vision. And commonest of amblyopia is refractive type of amblyopia. And the occlusion therapy, it has many disadvantages. With best corrected spectacles, there is recurrence is seen as per the literature review in 25 to 50% of the cases. So the advantages of the contact lenses that there is insignificant peak distance of fracture area from the cornea and neutral prismatic effect upon lateral gaze, an absence of anisophoria, unlimited visual field, and minimal anisoconia in anisometropia. So now there is a new treatment modality available, that is the binocular polarized video games. So they uses the binocular polarized glasses. So same background has been given to both the eyes, but enriched foreground to the amblyopic eye, and high contrast to the amblyopic eye, and fast paced engaging components are there that keeps the child engaged and interesting. And it is based on the principle that they can strengthen a broad range of visual tasks in adults with normal vision, including light sensitivity, contrast sensitivity, visual crowding, and visual attention. So this was the world's first registered clinical trial. 65 patients in each arm, age 6 to 12 years, -12 diopter to +3 diopter of the refractive error were included, and visual acuity difference between two eyes were at least 0.2 logmar. No misalignment or other ocular disease, and follow-up was done at 0, 4 weeks, and 8 weeks. And we did the Titmus fly stereo test and contrast sensitivity using the Pelly-Robson contrast sensitivity chart. So these are the different components of the OccluTab. We don't go into the detail because of the time constraint. So we come to the results now. So 99 were males and 96 females. Average age was 6.37 plus minus 2.06 years. 68% were myopic and 31% were hypermetropes. So at the baseline, the contrast sensitivity was 1.49 in the OccluPad group, 1.324 in the occlusion group, and 1.57 in the contact lens group. The best corrected visual acuity was 0.44 in the OccluPad group, and 0.384 in the occlusion group, and 0.416 in the contact lens group. And the stereo acuity was 71.65 in the OccluPad group, 64.85 in the occlusion, and 67.35 in the contact lens group. So at the 8-week follow-up, the contrast sensitivity increased to 2.24 with significant p-value of 0.05 in the OccluTab group, and 2.124, so increase in the contact lens group also, but there was no significant p-value difference as compared to the control arm. And the best corrected visual acuity also improved better in the OccluTab group as compared to the occlusion group. And stereo acuity, again, it also increased as compared to the baseline, and it was better with a significant p-value of 0.05 as compared to the control arm. So in the conclusion, treating amblyopia is an enigma, and most of the management modalities require patching, and the LASIK procedures had shown good results but are associated with keratosis, and that it's an irreversible procedure. So binocular polarized OccluTab requires very less time. It requires only 30 minutes per day and 2 days per week, and it goes on for 8 weeks, and the vision remains stable for 1 year. And the main advantage that it keeps the children keen and engaged without occlusion because there are video games. Thank you so very much for giving me the opportunity.